Okay, good afternoon, everybody. We're going to begin this press briefing. This is a City of City of Corpus Christi and Nueces County. Hello? Okay, you want me to start over? Or? Okay. Good, they didn't have me say San Antonio. All right. Okay, I think we're going to start over. That microphone did not work. And nor will this one stay on there, Kim. Okay. Hopefully that doesn't pop off. Okay, we're going to start over. The microphone wasn't working earlier, so good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager. And today we're here, you've seen us here before, focusing on our pandemic, the COVID-19 virus, and we have been doing joint press conferences with the city and the county, focusing on things like our statistics, how many COVID cases were there or are there, how persons are recovering in the hospital. On Fridays, we had typically brought in Texas A&M Corpus Christi to provide us additional information, and that was on top of our press briefings. But in the last week or so, we've modified our press briefings to be doing them just on Wednesday. And then on Fridays, from now on, we're going to devote the entire time to Texas A&M Corpus Christi. And the background on them is that several months ago, we asked Texas A&M Corpus Christi President, CEO, Dr. Miller, could we get some help from some of your great professors and scientists to help us model and predict what will happen here in the coastal bend when it comes to COVID-19 cases. So many months ago, we didn't have a curve, we didn't have predictions, and we have seen that now over time, in part from Texas A&M Corpus Christi scientists and professors. They put together a team that looked at what models they could use to help predict what our COVID cases would look like here. And then they also not only pick models, but they're looking at local data and data from the state of Texas to help populate those models and give us projections. So today, later on today, we'll be releasing, as we normally do, our numbers on COVID cases and recoveries and so on. And that information will be available on our website. And then on Wednesdays, I will be here, Annette Rodriguez, our health director, the city mayor, Mayor McComb, and the county judge, Judge Barbara Canales, will be here on Wednesday to do our more traditional press briefing that talks about number of cases and orders and how we should stay safe so we don't get the COVID-19 virus and how we can protect ourselves from not getting it. So that's just a little background in case there's new people joining us today. So with that, I'm going to ask Dr. Bird, who many know out there who have been following us on Facebook and YouTube and our channels. We appreciate Chris Six and KIII and the Caller Times who have covered this consistently for the community. And we appreciate the community watching. But Dr. Bird is here, Dr. Tissot is here as well. But Dr. Bird is the one that is presenting, so he's going to present today an update. The last time he presented was a week ago. And so we're anxious to see what the models look like, especially as we have seen in our briefing on Wednesday, that our curve, our kind of second curve from the two high outbreaks, including the meat processing plant as well as two transitional housing, that big curve is decreasing. So we want to see things like transmission rates and what does the future look like in terms of new positives. So with that, we'll turn it over to Dr. Bird, and we want to thank the community for watching, who's watching today.
All right, good afternoon, everybody. Thank you, Manager Zanoni, for that introduction. And this is our weekly presentation on the COVID-19 pandemic here in the Coastal Bend area. I'm here as a representative of the TAMU-CC COVID-19 Modeling Task Force. We have two objectives on the task force. One of them is to address public concerns and questions about COVID-19 and the interventions that are in place to address the pandemic. Today we're going to try something a little bit different to those of you watching online. We'll select a few questions from that are posted on Facebook Live, and they'll get asked to me by the end of the presentation. Secondly, the purpose of this is to enable evidence-based decision-making by our leaders in the Coastal Bend area, and potentially wider, depending on how important the discoveries we make are. And that's the purpose of the task force. Each week, we break up the presentation into 3 sections. The first section is on the data from the local area. The second section is on cell phone data and what we might foresee in the future. And then the third section is on models and projections into the future based upon all of that previous data. So starting with the case data, these are heat maps of the 12-county Coastal Bend area for which the report focuses. So this is going to be a little bit different than the Wednesday reports that focus on Nueces. We try to focus on the Coastal Bend as much as possible. On the left, what you see here is a heat map of the total number of cases, and you can see that Nueces County and secondly, San Patricio are the main areas where COVID-19 cases have been found in the Coastal Bend area. On the other side, you see the active cases, and again, brighter colors mean more. I got interviewed this week about numbers, and there's too many numbers going around, so if you don't like the numbers, just focus on the colors. The darker the color, the more there are. So again, Nueces and San Patricio have the most active cases in the Coastal Bend area. Switching things up a bit, this is a look at the number of tests that are being done per day. This is a smoothed average. I think it's a 5-day average. So it might look a little bit different than some of the other numbers that you've seen in the past, and we're presenting as points instead of bars. But you can see there's a general upward trend in the number of tests. I would say that right now the average number of tests per day is about 200. You can see that it kind of spiked up, and that was associated with the outbreaks that occurred a couple weeks ago when we were censusing many employees at the STX plant and at the transitional housing facilities. And because we're not doing as much of that censusing now, the number of tests per day are dropping down a little bit, but you can see an overall increasing trend in the number of tests that we're doing. And this is for Nueces County. This is where we have the data on the number of tests. And you can see the outbreaks right there, so that the increase in the number of tests shows up because of the outbreaks. This is the percent positive tests per day. So we take these values and we divide out the number of positive tests, and we can create this graph. And again, it's a smooth average over a 5-day period. And what you can see is that before the outbreaks, so this big spike here is from the outbreaks that we had a couple weeks ago. Before the outbreaks, the average positive rate was between 1.3 and 2.2%. Following the outbreak, and it's dropped down to a new lower level of around 0.7% right now. And that's been fairly steady over the past several days. So that's pretty good news. It can be hard to compare positive tests through time because we're changing the way we're testing and who we're testing and things like this. These are just the PCR tests. They're not antibody tests. But this is what we can do with the data right now, and lower percentages are better. This next figure shows the cumulative number of cases in the Coastal Bend area. That's the top line. We have 357 total cases that have occurred in the Coastal Bend area since the start of the pandemic right now. There's been 195 recoveries, and we have a new metric that we're showing that's been getting reported by the state of Texas for a few weeks now, which is the number of active cases. What I'll point your attention to is that with the number of active cases, it looks like COVID is going down. But you can see with the total number of cases, you can see there's an uptick, and that's happening because the recoveries are increasing now too. People that were in the outbreak are recovering, and it's kind of washing over in the active cases if there's any changes up or down in the number of cases. So anyway, we'll show all of it so that you can see kind of what's happening here. Luckily, for a long period now, the number of fatalities has been steady at 4 in the Coastal Bend area, and we'll hope that that continues. And again, right here, the outbreaks show right there in that steep upswing in the cumulative number of cases and the active cases on the graph. And hopefully there won't be many of those in the future, but we want to be prepared just in case that happens. Just for a comparison to Nueces, there's 268 total cases in Nueces right now with 117 active, and there were 148 recoveries with 3 fatalities. Okay, this next figure we like to show because it gives us a comparison between us and San Antonio. And we do this comparison because, let's face it, most of us love to go to San Antonio to go to the Riverwalk and go shopping, or maybe go for a weekend. And a lot of people from San Antonio come here to the Coastal Bend area. So it seems like a logical place that we'd want to compare ourselves to. Right now, there's about 2.1 times more cases in Bexar County, which is the most populous county in San Antonio, than there are here in the Coastal Bend area. And that number has, it was 3, and then we had the outbreaks, and now it's around 2. So it shows what kind of impact an isolated outbreak can have on our overall numbers. And what that shows, if nothing else, is that in general we've fared fairly well here in the Coastal Bend area with low numbers of cases, where just a few outbreaks at a couple businesses could make our numbers spike like that relative to what they were before. So again, this is per capita. So it's how many positive cases per 100,000 individuals. So it's more of a one-to-one comparison between the areas. It's not just the total number of cases. And again, you can see the outbreaks there. You don't see that in the Bexar County curve because they weren't affected by our outbreak here. This next graph is the new cases per day. And the new cases per day data is pretty noisy, is the way I like to describe it, with points all over the place. Each point that you see on here, whether it's a circle or a triangle, is a number of new cases per day. The circles are for San Antonio, and the triangles represent the Coastal Bend area. And then what we've done is we've fit smoother lines through this to show the overall trends. And so the lower dark blue line, which spikes up around May 18th, or between May 11th and May 18th, that's the Coastal Bend. That's spiking up there because of those outbreaks that occurred a couple weeks ago, but you can see that it's trending back down and coming back to around the level that we were at before the outbreaks occurred. In Bexar County, you can see there's been a few swings up and down. Maybe they've had a little bit more of a roller coaster ride than we have here locally, but Bexar County is also trending downwards right now, also in the number of new cases per day. This is similar to the last graph, except it shows a comparison between Nueces and the rest of the Coastal Bend. And in this one, Nueces is in orange. And again, what this shows, that large peak, that's from the outbreaks. It shows that Nueces County had more people that were involved with the outbreaks than the other counties. However, there is an uptick in the rest of the Coastal Bend that's associated with the outbreaks. There were some employees of the various facilities that lived in San Patricia or maybe another county in the Coastal Bend area, which led to an increase during the outbreak period and then a subsequent very small decrease. Now, I know it looks like a flat line, but it's because the spike in Nueces is so high. And if we were to change the scale of the graph, you'd be able to see more of an increase and then a decrease in the rest of the Coastal Bend also. So this is much better news than we had 2 weeks ago when we were going up the roller coaster. And I feel more at ease today. I don't know if anybody else does, but it definitely helps to have low numbers of new cases. Okay, so that's our summary of the data as we see it right now. Our second part of the presentation is on cell phone data. And again, the importance of the cell phone data is it can give us an idea of behaviors, how well our intervention's working, and what we might expect in the future, because if the cell phone data is predicting at some level whether somebody's going to get infected or how likely it is that more people will get infected, there's a certain amount of time from infection to showing symptoms. It's about 5 days, and there'll be a few more days until somebody that is infected shows up as a positive case in the data. So it's a way to look forward into the future. And again, we have the scene from the from the Dark Knight, where they use cell phones to save the day, and that's kind of what we're trying to do here. So because this is about interventions and their effectiveness, I think it's important to review the interventions that are in place right now. First, we're still under stay at home if you can, so we'll be interested to see are people staying home if they can? Can we see any evidence of that? There's been a loosening of restrictions on social and public gatherings. We're interested to see what effects that may have had, as well as the end of stay at home on the patterns that people have in their everyday lives and their movements. School closures are something that are still in place, and this is K through 12, universities, community colleges right now. The schools are closed. Obviously, everybody's encouraged to social distance. And I think it's important to point out that 6 feet is the distance you're encouraged to stay away, but think of it like this. Most dog leashes are 6 feet long, and sometimes people have a vicious dog, and you don't want to get within 6 feet of that vicious dog. You might stay a little bit farther away. And so that's something to think about. How far away would you stay from a dog that's snarling at you? Probably more than 1 inch past 6 feet. And that's a good way to treat your social distancing. Self-isolate when symptomatic. This is critical. Somebody that I know a couple weeks ago got a sore throat and a fever, and they were convinced that they didn't have COVID-19. And I said, well, how do you know? They're like, well, I don't know. I just don't think I do. And so I directed them to call the county hotline and contact their physician and follow the instructions that they were given. So, I mean, we all want to think it's not us, but we need to treat it like it is us. That's the way that we beat COVID-19. If we all treat it like we have it and everybody else has it, and then hopefully nobody has it. So self-isolating when symptomatic makes it so that you don't transmit the virus to somebody else. So school closures. We can look at the effect of school closures with cell phone data. This is the relative foot traffic. We've scaled this to the relative amount of foot traffic that was occurring in January and February in Nueces County, and we made that value be 100. Why 100? The majority of people in the room like that better than 0 or 1, so 100 means normal. For the middle of the semester, schools are in session. What we can see is there was a rapid decline in the foot traffic to schools, and it's kind of leveled off somewhere around 10%, and maybe is slowly increasing since the May 1st end of stay at home, but it's still relatively low. So one thing that this tells us is, does the cell phone data work? And the answer is yes. We can see a dramatic decline in the schools. We know that schools aren't in session, and it makes a lot of sense, but it's making sure that this works, and what does it look like? The reason why the activity doesn't go to 0 is because the buildings still need to be maintained. I know at the university, probably one of the reasons for a slight uptick in the amount of activity at the schools. I know some graduate students at the university are working on their projects again. I've seen some of them in the lab. I know for my own lab, I encourage the students to stay at home unless they need to be in the lab. So anyway, that's the schools and what the cell phone foot traffic tells us about that. So we're going to transition from the schools to schools and hotels. Now, looking at the foot traffic at hotels is interesting because it gives us some sort of metric of how many people are coming in from the outside relative to normal. And realize here that when our baseline was in February, the foot traffic to hotels in February is probably a lot less than it is in the summertime, or say Memorial Day weekend, like it was last weekend. And so we expect that this metric is going to go well above 100 at some point if we keep having more and more visitors coming into the Coastal Bend area as the summer wears on and people want to come and go to the beach. Now, you might be wondering what was happening right here. This is spring break. On March 9th, that was the that was the Monday of spring break. There was a huge spike in hotel occupancy. This is a smooth line, but it's interesting when you look at just the data points. There was a rapid drop-off within that week of people leaving the hotels. And this was the week, March 9th. This is the week when the NBA canceled their games. This was the week when we all sort of realized that COVID-19 was here. Since then, hotel traffic dropped to a low around Easter weekend, and since then has been steadily rising. And over the past weekend, we crossed the threshold of what was normal in February for hotel foot traffic, and we're now above that on average. And so, like I said, we might expect to see a trend like that continue because there's more people coming to the coastal bend in the summertime to enjoy our beaches than in February. How about stay at home? How many people are still staying at home if they can? This is a good time to point out it doesn't matter as much how far down the line goes. What matters is how far back up it's come relative to how low it was. Because right at the lowest point, that was the peak of our efforts to try to contain COVID. We had a stay-at-home order. We weren't really going out to the grocery store if we didn't have to. We were really trying to stay at home. I think a lot of people were doing that. Now, since then, we've had open Texas. People have had cabin fever. People are leaving the house more and more. The way this metric works is if your device leaves the home, then you're counted as having left the house. So right now, we're somewhere around 50% of people on a day-by-day basis seem to be still staying home if they can relative to what the lowest was. So we went down to the absolute lowest. That's now increased 50% of the way towards normal. And it's not increasing very fast right now. It's staying pretty level. And that might be the case because of people like me. I can telecommute, so I try to stay at home if I can. I've only been to the university, but a couple times since the pandemic began, and I plan to continue doing that. So those are our 3 cell phone metrics, and we'll come back to the 4th. So the last one we're adding here is encounters. And encounters is the metric that I've been showing for the longest period of time. And this is an estimate of how many people in the coastal bend are coming within close contact of each other to the point where they might be able to transmit the virus. Now this is baselined, again, the same way. 100 means normal. Normal means before March 9th, before we really realized that COVID-19 was here in the coastal bend area. You can see that it dropped off like the other metrics a fair amount. It hit its lowest point at Easter, and since Easter, it's been steadily increasing. This is a smooth line. It doesn't show all the data, but Memorial Day weekend, the number was about 150 on this scale. So everybody's wondering what was happening with Memorial Day weekend. The number of encounters on this scale was about 150 on the Saturday of Memorial Day weekend, but the average is slowly increasing. Now, what we see in that encounters data, if I were to project the points on here, are wild swings from the weekend to the weekdays, and I think that's, again, people coming in with the hotels and people coming in from the outside. So we see these huge differences in encounters from weekdays to weekends. Ultimately, what all of these metrics say, or overall the picture is that the probability of transmitting COVID-19, if we don't social distance, if we don't wear masks, if we don't do things to stop the transmission of COVID-19 in close quarters, it shows that it's probably increasing, at least based upon how closely we're coming in contact with each other. And I've said this a couple weeks in a row. Obviously, if we put ourselves inside of a bubble, we would come within 1 foot of each other, but we wouldn't be able to transmit COVID-19. So that's what we're trying to do with wearing face coverings, with staying 6 feet away. We're trying to make sure that we don't transmit COVID-19, even if we are close enough that a cell phone GPS can't tell that whether you're 6 feet away or 20 feet away from somebody else. Okay, so those are our first 2 sets of data that we look at. Now we're at our last set of data, which are the model estimates and predictions. We do this each week. Again, something that stuck with me this week was the interview on the numbers and that there's too many numbers and it's very complicated. And my answer in the interview was the most important number is this one, the transmission rate. And so right now our estimate is that for every person that gets infected with COVID-19, if we did no effort, if we put no effort into mitigation, if we put no effort into social distancing, if there was no stay at home, if we behaved the way that we did before the pandemic started, then 2.7 people would get infected for every one person that gets infected. So what this would look like is we start with one person infected. After 1 week, they're predicted to infect approximately 3 additional people. And then those 3 additional people are predicted to infect an additional 7 people. Those 7 people are predicted to infect an additional 20. And those 20 are predicted to infect an additional 53. Overall, this turns into 84 people infected over 1 month. So it doesn't take very long for just one person. If there's a scenario where there's not a lot of social distancing, if the virus is allowed to transmit the way it normally would naturally, it can spread like wildfire. And that's one of the reasons why we're stuck here in this pandemic. Now, it's also one of the reasons why we're doing things to try to stop that from occurring. So our estimate right now of the present transmission rate is 0.9. Now, without interventions, 2.7. Our estimate right now with everything that's happening is 0.9. And if you've been paying attention over the past several weeks, this is a very important number because what it means is that we're predicting right now that COVID-19 is receding and not expanding in the Coastal Bend area based upon the model that we're running to estimate this value. We actually run 2 models, and both of them are in fairly good agreement that 0.9 is a reasonable number that explains the fatality data that we're seeing in South Texas. This model is parameterized off of South Texas, so it's bigger than the Coastal Bend. One of the reasons why we do that is that there haven't been enough fatalities in the Coastal Bend to be able to run the model in the first place. So we had to expand to larger parts of the Coastal Bend. So this number is for South Texas. It's from here to Laredo and south to McAllen to the border. That's our estimate of the transmission rate of the virus. This turns into only 1 person getting infected each week for a total of 5. And a way to think about this, maybe a month ago or a month and a half ago, this value was 0.5 in the middle of the stay-at-home, and I said it was like a coin flip. Well, now it's like a dice roll. If you roll dice and you get anything other than a 2, a 3, or a 12, you're going to transmit the virus if you get infected. And that's a way of thinking about the probability of infecting somebody else. So it's pretty hard to roll something other than those 3 numbers. You have about a 90% chance of rolling something else, which is how this works. There's a 90% chance that you infect 1 person each generation of the virus. So that would end up right now with 5 infected per month versus a much higher number if we weren't doing things to mitigate the transmission of the virus. Something that Manager Zanoni has asked me in the past is that, well, let's see how this number is changing over time. So this is a new graph that shows how these numbers, the last 2 numbers that we showed, are changing over time, the 2.7 and the 0.9. And so over here, we have our transmission rate without intervention. So this is the 2.7. That line fit through the data. The average that we've measured for or estimated for this value over the course of May is about 2.7. So you can see that line fit to the data. That's without interventions. Our actual estimate of what the transmission rate, or our estimate of what the actual transmission rate is, has been declining. Last week, our estimate was 1.3. The week before, it was 1.4. Here you can see almost every day in May, every time we run this model, which takes several hours on a computer, very powerful computer for it to run, so we don't run it very often. But we have data points from every time that we run it, and you can see that it's trending down through to today. And maybe the last couple days it's leveled off slightly below 1. The bars that you see on here, they're credible bars. Don't think about it the way you think about normal error bars, that if they overlap it means they're the same. That's not the way these values work. Just think about it as the circles are the best estimate and the line is the best fit shape that describes the change through time. And so The interesting thing that we're seeing here is that you just heard me say that the cell phone metrics are telling us that these numbers should be going up, but what we're observing through the models, which are one of them is based upon fatalities, the other one is based upon number of new cases, they're both indicating that there's a decline. So the way that I reconcile this is there's something happening that we're not accounting for right now. And I can't identify what that is without further investigation, but it's good news, at least for right now, that we're below 1. Something I want to emphasize is that the cell phone metrics indicate that we still have a ways to go back to normal. So we still have control over this transmission rate. And so right now we're a little bit below 1, but let's say everybody takes off their masks. That will push us back above 1. We do have an effect on this number. Even if there's something that's occurring that's causing it to go lower that we don't understand it could be random chance, but it doesn't look like it to me. Nonetheless, we need to continue social distancing. We need to continue wearing masks because it's only at 0.9. It would be a lot better if that value was 0, which it's not yet. This is a new figure that we're showing today, which shows the transmission rate. So this one, our actual estimated transmission rate, the one that was in the blue on the previous slide, on a map of Texas. So we've estimated it for every public health region in the state of Texas. This is as of yesterday. We do have graphs for every one of these counties, and we have figures like the last one that you saw for every one of the public health regions. What you can see in this pattern, and again for people that don't like numbers, don't pay attention to the numbers, just look at the colors. Blue means decreasing, red means increasing. This is the transmission rate. You can see a scale over there. So the pattern is non-random. It's a geographic pattern where the lowest transmission rate is here in South Texas, and the highest transmission rates are found in northern Texas, the highest one in the northeastern corner of Texas. So this is a really interesting phenomenon that we're observing here for the state of Texas. And this is one of the reasons why on the task force, while we're tasked with looking at just the coastal bend, we're looking at larger areas when necessary to get information that's important to us. This is something that we'll be investigating in the very near future and trying to decide, or not decide, but test what sorts of factors are associated with this geographic pattern that you see in the transmission rate. So once again, very simply, overall in Texas, the transmission rate says that COVID-19 is spreading. But in South Texas, our estimate of the transmission rate says that it's receding. If you go up through Texas, you transition from receding to spreading, is what our estimates say right now. Another model we run is looking at the hospital utilization and our projected hospital utilization. So this graph looks a lot more appealing to me this week than last week, where it was curving up this week. With this new lower transmission rate projecting forward, we have a nice, steady, low-level number of cases of people that have severe enough reactions to COVID-19 that they might need hospitalizations. The black circles are actual hospitalizations. And what this means is that on any one day, there's a certain number of people that get admitted into the hospital or are in the hospital. And so, for example, on this day, there were 10 people right there, 10 people in the hospital. Now, maybe they came into the hospital and they left, maybe they stayed overnight. We don't discriminate between those things. So each day, how many people needed hospitalization for COVID-19? And you can see the blue line is the model projection, and the ribbon represents the error around that projection, that the actual numbers of hospitalizations fit fairly well with the model. And we're well below capacity. At the very least, a rough estimate of how many additional COVID cases that could be handled on average in the coastal bend area is about 350. This number is really hard to pin down for any one specific time because the hospitals are constantly changing with the number of people that they have in there. But on average, there's about room for 350 additional people due to COVID-19. So right now, things are looking pretty good. Another thing last week, people requested ICU, not just hospitalizations, but what about the ICUs? Do we have enough space? for that. And again, this is just like the last figure, except it's for people in the people that are in the hospital and they're actually in the ICU. The black points are those actual numbers. The blue line is our projection for that. And again, we're fairly low on both the actual numbers and the predicted numbers. The peak that you see there was during the outbreak. So you can see during the outbreak, we peaked up to about 9 people in the ICU on one day. But we haven't come near the capacity, which is estimated to be about 30. And what that means is that there's, on average, about room for 30 additional people in the ICU in the hospitals and in the local area. And we're well below that. And the projection for the future is to stay low. As long as the transmission rate stays around 1, the projection for the future will stay fairly even. Okay, so let's wrap this up. In summary, new cases in the coastal bend have declined. I think everybody saw that. Something that I've been saying the past couple weeks is that they haven't just declined, they've declined even if we didn't have the outbreaks. While I didn't show it this week, I can subtract people that got COVID-19 because they were associated with a location where there was an outbreak. I've subtracted those out of the data. There was still a peak in cases and then a decline. So it's not just because we're coming off of an outbreak. There has been a decline. COVID-19 is not presently expanding in South Texas. That's our projection right now. That's our estimate based upon the models that we're running. Now, cell phones predict that it should be expanding, but fatalities and epidemiology and cases indicate that COVID-19 is contracting in South Texas right now and in the coastal bend area. Our estimated transmission rate is 0.9, which means that on average over time, the COVID-19 pandemic locally should start to shrink as long as there aren't other factors that change, and it's slowing down. Now, I want to emphasize this is good news, but it's not time to be complacent. We control that number to some level, that 0.9. If we stop wearing masks, if we stop social distancing, if we stop paying attention to different policies that are in place to make sure that we don't transmit COVID-19, that number can easily go back above 1. There's an interesting geographic pattern in the transmission rate in Texas that we're going to be looking at closely and following up on, and hopefully next week we'll be able to give you an update on that. You'll have to bear with us. We just found that pattern a couple days ago. And so since then, we've been just starting to organize ourselves into trying to get the data to determine what is causing that pattern. Importantly, hospitals are presently well within capacity. I think everybody should know that we on the task force, we're in close communication with our local healthcare professionals, and they're in contact with us. So there's a good free flow of information. If we see something looming on the horizon, we can let them know. And if they're seeing something on the ground that we're not getting out of the models, they let us know. So there's a good level of communication that's occurring there. And I look forward to our future work with the hospitals and a future good relationship. I want to emphasize that while we're kind of in a good place right now in terms of, especially relative to where we've been, it's no time to get complacent. It's important to help contain local outbreaks. Just because the overall transmission rate is going down doesn't mean that the transmission rate within your place of business is not higher than it is outside of your place of business. Now, the way that you decrease the transmission rate in your place of business is to employ social distancing policies. People wear masks. People stay more than 6 feet apart. These types of things are important. It's also important if you are a business owner that there's no shame if an outbreak occurs in your place of business. The important thing is containing it. And I think that all of the establishments so far that have experienced a flare-up, they should be commended for fairly quick action in testing everybody, containing the outbreak, and doing the contact tracing, and changing the policies such that the probability of transmission of the virus within those places is now lower than it was before, and hopefully will prevent outbreaks in the future. All these people involved, the businesses, the leaders, our local leaders, the essential workers that were involved with this, the other people that were involved in the outbreaks, and the frontline workers that are helping to test everybody and treat them should all be commended for this. And there's a lesson here that if you don't close loopholes in your social distancing policies, then COVID-19 can find them. And you'd rather find them before COVID-19 does. Lastly, what can each of us do? Say we're not a manager. There's still things that all of us can do. One thing is that the CDC recommends that we all wear face coverings when we're out in public, that we self-isolate when we're symptomatic, that we stay at home if we can. If you're telecommuting, continue to do that. There's no reason to go out of your way to leave your house if you don't have to. Postpone social gatherings, or you can have them online. Just because some people are having social gatherings doesn't mean that it's all thrown out the window and we should all just throw up our hands and all have social gatherings. The more of us that don't have social gatherings, the less the transmission rate is overall in our community, and the less spread of COVID-19 there is. So every action that we all take has an impact and it has an effect. And it's important for us to support testing and support contact tracing by our healthcare professionals and by the county and by the National Guard, because this is something that enables us to contain an outbreak. What you saw in all the graphs was a huge spike, and you saw it come down. It came down because the outbreak was contained and it was dealt with. And one of the huge reasons why that happened was the testing and contact tracing. So it's important that we all support that. I'll end this with, you can find some of our reports and information and dashboards online at tinyurl.com/TAMUCC-COVID. And you can go there, and if you like numbers, there's plenty of numbers there to see, right, Philippe? All right. And last but not least, I want to thank everybody on the task force. There's not enough space on this slide to show everybody's name, but there's a lot of people that have contributed. And people that aren't on here this week, Dr. Tissot and I participated in a meeting between a number of doctors and other healthcare professionals in the Coastal Bend area that are coordinating on how to react if there is an outbreak in the future, if there is a big upswing. So that should put everybody's mind at ease too. And I want to thank them for helping give me feedback that went into the presentation this week. All right, thank you.
En resumen, el condado de Nueces seguido por San Patricio son los condados que más casos por virus han reportado en el área de la costa. En total, en el área de la costa se han reportado 357 casos, 195 personas se han recuperado, 159 casos aún continúan activos y se han reportado 4 muertes. Esto es en el área de la costa y no solo en el condado de Nueces. Los casos nuevos por el virus en el área de la costa están disminuyendo. En cuanto a la información basada con teléfonos celulares, esta información se obtiene para pronosticar la transmisión del virus de persona a persona y para determinar si las órdenes han hecho una diferencia en cuanto a la transmisión. Entre estas órdenes se incluye el quedarse en casa, el cierre de escuelas, el distanciamiento social y el aislarse si cuenta con síntomas. De acuerdo a esa información, las escuelas han aumentado poco el número de personas en los edificios. Los hoteles han registrado un aumento significativo de visitantes en el área. El número de las personas que ya no se están quedando en casa también ha aumentado. Si no existiera ninguna orden para aminorar la transmisión del virus, se estima que el radio de transmisión del virus es de 2.7 personas por cada persona infectada. Eso significaría que en un mes una persona pudiera infectar hasta 84 más. Actualmente, con las órdenes para evitar el radio de transmisión es de 0.9 personas, o sea, en un mes hasta 7 personas estarían infectadas. Esas órdenes son el distanciamiento social, el uso de cubrebocas, así como la higiene personal en general. La sugerencia para disminuir el radio de transmisión del virus es la misma. Continúe usando cubrebocas, practicando el distanciamiento social.
While we're waiting, something I forgot to mention is that it's important that if you have some other healthcare problem that you go to the doctor or you go and you get treated for it, you're much more likely to have negative health outcomes if you don't go to the doctor than if you do right now. So COVID-19 is not really a good reason not to get the medical treatment that you need. And something that we didn't show but that we see in the cell phone data is that doctors' offices and healthcare professionals' offices have lower foot traffic than they did before the outbreak, and that's something that we'd like to see increase so that we know that everybody is being taken care of and is healthy. So we'll field maybe the most pressing questions from the Facebook forum.
Dr. Bird, I'm Dr. Edwards from Texas A&M Corpus Christi. And we have a few questions from Facebook. One from Nelva. In response to your cases per 100,000 slides, Dr. Bird said, "We need to be prepared." What is he referring to, and how do we prepare?
I'll try to back up to the slide. A lot of animations in these.
And these will probably go in order.
Cases per 100,000. I don't remember saying that we need to be prepared, but I think what we need to do is not rest on our laurels right now, given that the number of cases are low. What I'm trying to say is that you should continue to social distance even though the number of new cases is low. You should continue to wear masks. You should continue to be vigilant and try to stop the transmission of COVID-19.
Thank you. Second question from Russell. If you remove hotspots, outbreaks, what does the transmission rate look like?
It looks like exactly what we have. The outbreak didn't affect the transmission rate estimation. To delve into that a little bit deeper, our primary way of estimating the transmission rate is through fatalities. We've seen no fatalities from the outbreak. Secondly, we're estimating that transmission rate, at least in a broader region, based upon fatalities that's not just here in the coastal bend, not just in Nueces County, but it's from here to Laredo and south to the border. It's called Public Health Region 11. It includes McAllen, it includes Kingsville, it includes a lot of different areas. So that's one of the reasons why the outbreak was a blip on the radar of our model, because we haven't seen any fatalities associated with the outbreak yet. And then the model that is based upon new cases, that I also see what the indication of the transmission rate is from that. I do subtract out the individuals that contracted COVID-19 at the beef plant or at the transitional housing facility. So you're already seeing our estimate of the transmission rate, either something that's not affected by the outbreak in the first place that we had here locally, because it was just a flare-up, and we do try to do our best to subtract out all the cases to see what the transmission rate was otherwise. Now, if the outbreak wasn't contained, then we obviously would have pivoted and said, okay, well, this outbreak's not contained, we went up and we're continuing to go up, then that would drive our estimation of the transmission rate.
Good, you answered the sub part of this question, which was, did you use or take out the other places like nursing homes, meat markets?
Yes. So the health district defines an outbreak, as far as I can tell, as 3 people contracting COVID-19 at approximately the same time at the same establishment. So that's the protocol that I used to subtract the effect of outbreaks out. Now, I want to be very clear that if outbreaks are driving the whole pattern here, and say outbreaks are responsible for a large proportion of the cases that we see in Corpus Christi in general, then we would not take them out anymore. So we were watching to see what happened. If we saw evidence that one outbreak triggered another outbreak, then we would have pivoted and said, okay, we shouldn't remove the outbreaks. But right now it looks like that was an isolated spike on the radar as opposed to a pattern that is occurring all over the coastal bend right now.
Third question is from Margaret. Could low transmissions rates be low because of lack of community tests by the county?
I don't think so. One reason is that, again, the transmission rate, our primary estimation of the transmission rate is calculated from fatalities. And because there haven't been enough fatalities in the local area, it's based upon an estimate of the transmission rate in a much larger area of Texas. Over that area of Texas in the past couple weeks, we don't expect that there's been a huge difference in who's had a severe enough infection to have a mortal outcome from that, and that they did or didn't get tested. We think that's equally likely in the past couple weeks, say the last 14 to 21 days, that somebody that was sick enough to die from COVID-19 was highly likely or equally likely over that time period to have been identified as positive, whether it was 3 weeks ago or today.
The last question is from Russell. Are statewide transmission rates tied with temperature changes?
We don't know that right now, but it's something that we'll look at. If you look at that graph, every county, or it's not every county, every public health region that touches Oklahoma has a higher rate of transmission. The one that has the highest, it also touches Louisiana. That's something that we've discussed. I think that right now, we know that there's a pattern. I think it's important that we identified it, and it will be important for us to follow up on that and try to find statistically significant relationships between things like weather patterns or, say, the level of care, the amount of testing that's being done, socioeconomic factors. But there's a clear north-south pattern that's there that presumably the farther south you go, the hotter it gets, but the Gulf of Mexico affects that a little bit too. So if there's no further questions, I want to thank everybody, and I'll turn it over to Manager Zanoni.
Okay, well, that concludes our briefing today. That was a great presentation, Dr. Bird. I think one of the best ones yet, frankly. And if somebody joined late or wants to rewatch this, go to the TAM-UCC website, right? This is there. It's also on the city website, each of the briefings that we've done over time. Today's is there, and this is great to rewatch. I've done it myself because it's great information. Dr. Bird goes relatively slow, but it's always good to see it again. You can also take snapshots of some of the slides and share those with your friends and families and neighbors. I've done that myself as well. So we appreciate all the comments we got from Facebook today. A lot of good comments, a lot of good thumbs up for Dr. Bird. They love Dr. Bird, and he does great. And all of TAM-UCC, the whole team, we know it's a big team. That slide that had all your team members, this is a big effort, and the city is certainly very appreciative of the work TAM-UCC has done, and we look forward to continuing to work with you. Right now, the plan is through the fall, through winter, actually through December. And so we'll be bringing to the community these trends and graphs. We're not out of the woods by any means yet on the pandemic, so we want to continue to rely on the scientific and professional community out there. We appreciate the knowledge and the expertise that they bring. So with that, we're going to close today's briefing. We will be back. The city will be back this coming Wednesday. It will be myself here, Annette Rodriguez, our Public Health Director, our Mayor, Mayor McComb, and our County Judge, Barbara Canales. Will be here to update you on the numbers that have taken place. They're being updated every day and placed on our website, but we'll be here to communicate to you directly, and the judge and the mayor will provide additional information as well. So you all stay safe. Remember those key tips to keep your hands clean. Don't touch your face with dirty hands. Use a face mask if you're in public. Stay 6 feet, social distance, and stay away from crowds. Stay at home as much as possible. We can beat this, and we want everybody to stay safe, so everybody has to do their part. Thank you. We'll see you next week.